Hello and welcome to Family Matters, brought to you by ACAP, the Academy of Clinical and Applied Psychoanalysis in Livingston, New Jersey, and Hometown TV in Summit.
Of being alive.
Her behavior is a communication about what she's feeling and denying consciously. And you work to help her translate that into language.
Translate in language, allow her to talk about that, you know, complain about the people who most likely criticize her that she's putting on weight, and be with her in her attempt to deal, because all the symptoms are an attempt to deal with the pain and anger and despair of her loss. And she becomes very isolated. You know. The more she talks, the closer she will come to a certain understanding of what she herself is doing. Wouldn't that?
Mm-hmm. I would say, you know, and one of the lovely things about good grief is that that sense of isolation, all of a sudden you're surrounded by other people like you who have also experienced the death of a parent or a sibling. And if you don't have the language for it yet, or even the connection to the emotions, you're seeing it and hearing it all around you in your support group. So we're a peer support group model. We're not counseling or therapy. Mm-hmm. So kids come and they get to be right where they're at, feel what they feel. All feelings are accepted and okay. And so, you know, and it's a process, you know, over time. So by just being with other children, a child who comes to good grief or a teenager, they may not speak for 6 months, but they're taking in a lot. And it really is, it's normalizing, it's starting to make it normal for them that, you know, what they're hearing other kids give voice to what they're feeling inside.
It's an assimilation
process. It's an assimilation. And just there's so much power in knowing that you're not alone, that you're not the only one. And then eventually, you know, again, like letting them, it's their process, letting them be in denial, you know, until they're not in denial, you know, until they're ready to talk about it, whatever they're, you know, whenever they're ready to talk about it.
So you, like we as modern analysts, work in a way that you use the child as a consultant in how they're progressing through the grieving process, grieving and recovery process.
We follow their lead. So we don't go in and try to fix them or solve, there's nothing to fix. We don't try to take their pain away or make it better, because you can't. We walk with them. We really see ourselves as companions and witnesses to the families and to the children who are grieving. And I think what's so important is creating that supportive environment so that they don't feel alone, letting them hear other children, for the parents to hear other parents, to reach out to one another so they're getting support from the community. We're really a microcosm, I say, of what we'd like the broader community to be in terms of being that safe, supportive place where you get to feel what you feel and be where you're at, and where people are not, you know, pointing and saying what's wrong with you and why you're, you know, gaining weight, because those are just, you know, symptoms of what's underlying. And I love what you said earlier about, you know, the loss. We always say at Good Grief, the parent died, but the relationship is still there. And so at Good Grief, we focus a lot on remembering, on memories, on helping them tell their story and learning to integrate the loss into their life, so that it's not like, okay, now the old way was, you know, forget about it, don't talk about it, don't keep pictures up. We say, leave the pictures up, share memories, tell stories, use the name of the person who died with the child. You know, say, I remember when your mom brought cookies to class. Kids love to hear the name of their parents. So it's very natural. That's the thing we always say at Good Grief. Grief is not something pathological. It's a very natural response to loss, which is also just a natural part of life. And so it's really learning to just be, as a society, much more comfortable with it and use the word died. And the other thing, you know, we've talked about, I mean, when people talk about grief, it's not just due to death. Children and families grieve so much. We grieve all of the losses in our lives, whether divorce, separation, abandonment. But a child who doesn't get into the college of choice, or who doesn't make the team, or doesn't get the grade, or has a relationship end, that's grief. And I think one of the things that's lacking in our society and our schools is the emotional education of children, and of giving them tools and ways of coping with all the painful feelings and conflicting feelings and emotions that come up around all the losses in their life, when their best friend moves to a new neighborhood, or when they have to move. So these are all losses that families experience.
This is a wonderful conversation, and I'm seeing that we have very little time left. I think we have to have another program to continue talking about it. We still have a couple of minutes, because I see I have at least 5 more questions that I really want to ask you. But the one that, if we have a couple of minutes left, that I was thinking as you all were speaking, is how do we as therapists, as a director of a program where you're immersed in grieving and being with people, how do we process that? What's the impact of working with these populations on the therapist and the staff who are working with them?
We have layers and layers of support.
How do you go back and go into, transition into your own world? Layers of support, you say?
Yeah.
Layers of support, and education is helpful. I'm in analysis. I have supervision, and consult with other therapists and teachers. So I think those are all the layers for me.
So you use the resilience model. The resilience model of using social relationships, professional relationships as resources to discharge or integrate all those feelings.
Yep.
What do you say?
Well, actually, it's a very important part of what we do. The volunteers who facilitate our peer support groups get support before and after they're with the family, so that they're getting a support system and a place to talk about what comes up for them. And we're actually looking at how to provide support for our staff, because it's a lot. It's a lot of emotional information and experience. So.
That's right. You've asked us to do the staff development, which ACAP does with many organizations.
Yes, yeah. And personally, I've also, have a lot of support system friends in the gym and yoga, and I've learned over the years things I didn't know as a kid, healthy ways of coping with my feelings as opposed to unhealthy ways.
So resilience can be learned.
Yes. Yeah.
What do you say, Dr. Nista?
I don't know if I have a couple of minutes on it.
What
I'm saying that we do what we suggest to our people to do, to our clients to do, to seek support. I remember when I went through the 2 children who died after the September 11. I was talking to you almost every day. I was talking to everybody in the school almost every day, because it was such an emotional charge on me to have 2 children who were telling me in therapy that they wanted to go after their parents, that they couldn't tolerate life without their parents. So that was, the sense of inadequacy, the sense of incompetence, the sense of hopelessness which I experienced, the sense of major loss. But, I did exactly what I was trained to do, and what all of us are trained to ask for support, to ask for help, and to understand that at such moments, we need the friendship and the support of the people around us in order to go over the
community.
Thanks, everybody, for being here. I know we're going to need to come back and do another program, because so many ideas have come up that I would love to discuss, and I'm sure that the audience would love to hear about. So thank you all for being with us at Family Matters, and we hope to see you again soon.
ACAP may be one of New Jersey's best kept secrets, but with time I think you'll get to see, through our different programs, what an important community resource and valuable educational institution we are. Whether through taking classes for personal growth, professional development, or graduate credit, through our many conferences and workshops offered throughout the year, or by accessing mental health services through our clinic, the North Jersey Consultation Center, ACAP is committed to helping people get along better in life.